Hello and Assalamu alaikum, ladies and gentlemen. You are listening to Radio LUMS and I'm Ibrahim Arif. Today, joining us is Dr. Hassan Rauf Chaudhry, who is an assistant professor as well as the program director of Masters in Healthcare Management and Innovation at the Salman Daud School of Business at LUMS. Dr. Hassan works to collaborate with different industrial sectors to carry out sector-specific diagnostic studies to identify gaps and to recommend organizational and policy-level interventions. This interview is a part of a series of interviews about different MS programs here at LUMS. We are here to focus on Masters in Healthcare Management and Innovation. Dr. Hassan, welcome to our show.
Assalamu alaikum, and honored to be here.
How are you doing? Ramzan is just nice.
Alhamdulillah, looking forward. So yes, that will have certain requirements. So our classes generally going ahead in Ramzan, but I think it should be manageable, inshallah.
Inshallah. Well, before we actually go any deeper, let's start. Could you please give us a brief overview of this program?
All right. So this program was initiated 2 years back. So 2020. We had our first cohort, and so that cohort is at the moment they're almost set to graduate. The idea was at SDSB we were looking at areas or industries where we have not been able to create an impact as compared to other industries. So healthcare was one because it's a specific sector, and given LUMS vision in terms of contributing to these sectors. So education being one, so we have School of Education.
Yeah.
So healthcare, so that was the idea to come up with the program so that we can collaborate more and play our part in improving the sector itself. So that was the vision behind coming up with this program.
Mm-hmm. So, who is this program targeted towards? Like, what academic background would make a student most suitable for this program?
At the moment, it's not, so it's open for people with different backgrounds. So, I'll share in terms of the cohort, the first cohort, as well as the second cohort. So, almost 70% are coming from some sort of medical-related background. There are almost 40 to 50% are MBBS doctors, some with some dental background. And then there are some people who have had an opportunity to work in this sector from management role, finance, IT side. So we started off this program. It was a full-time program, so running during the week. And so that required full-time commitment. So a lot of people reached out and people who were working, so it was not possible for them to join the program.
Right.
So next year's second cohort, which got admitted last year, that was September 21. So we moved the program to the weekends. So now it's a weekend program.
Mm-hmm.
And so as a result, the batch size increased, the number of applicants increased. And along with that, the experience of people who are in the program that also increased. So that has also positively affected the discussions we have in the class.
Right. But there's no prerequisite of having prior work, right?
There's no prerequisite. So having some sort of exposure to in the sector would help, but that's not the defining criteria. So it's when during the interview process, we're trying to look at how passionate they are in terms of, we're looking at the commitment. So we don't want people who are just there to get another degree. So we want people who see themselves playing certain role, contributing towards this sector.
Right. Let's take a deeper dive into this program. So what is personally your favorite part of this program? Like, what do you enjoy teaching the most?
I teach, so my background is operations and supply chain. So I come from the process perspective. So I'm not a clinical doctor, but we see somebody entering a healthcare facility, so that's a process. So a patient coming in goes through different processes. So we have to look at it from a process perspective. So that's what I bring to this program. And in terms of the part that is most exciting is, so this program is structured in different modules. So once the students have gone through the courseworks, they're required to work for, it's a 6 months internship. So it's not a regular internship. So it's like a project-based internship. So people from healthcare sector, they come up with their problems, and the internships are structured around those problems. So during those 6 months, they work under the supervision of faculty, and but to come up with solutions, implementable solutions for the healthcare
On
sector.
real world.
On real, yes.
Right. And with this program, these different projects, what are some key skills that the students can learn, and how do these skills help them in their future endeavors?
It's basically what they learn in class, so they get to apply that in real world setting with the different constraints that they face.
Yeah.
So that's what we want them to go through. And secondly, so before they go for actual assignments, so this gives them an opportunity to have a supervised internship where they keep on coming back, discussing their problems, discussing what could be probable solutions. So that's where we keep on coaching and mentoring them, so that once they finish, they're all set to take up those tasks individually.
Right. I'm interested to know, Vaise, where you have had 2 cohorts by now for this program. Where have your students impacted the most?
All right. So the first cohort is about to graduate. So the cohort is almost finishing up submitting their reports on their projects. So we have, for this, specifically this part, but also in terms of how we have designed. So over 2 years, we have evolved. We have made certain changes based on the input from the actual players in the industry in terms of what are their actual issues and what are they looking for from people who would graduate from LUMS. So we do incorporate that in designing the course content as well. So we are regularly updating that. And in terms of partnerships, so over the years, we have signed MOUs with all top hospitals, Shaukat Khanam, Shifa, Islamabad, so in a discussion with Aga Khan Hospital, and then Shalimar Hospital, Evercare Hospital. So they are also on board, and they are also eagerly looking for the graduates from this program.
Mm-hmm. So the primary field of work after graduation for these students?
That's at the moment we're looking at these large tertiary hospitals,
right,
where they can go and take up these management and administration positions and bring up improvements in patient journey.
Right. So apart from, the stakeholders, how can this program help the students themselves to accomplish their, own goals?
So I would answer it from 2 perspectives. One is the contribution that they can make, and the other is their personal development. So given lack of trained people in this area, so there's huge scope. So at the moment, there are more requirements for projects or placements that more than that we can service. So our first cohort, every individual student had options for multiple projects. So we had to pick and choose based on the mix and match of their competencies. So that's the positive side in terms of the space that there is. And with that, it is linked with in terms of the improvements that they can bring in, plus the opportunities to grow, because it's such a nascent sector, especially from management and administration purpose. So there's a lot that can be done. And in fact, so now our students, once they are finishing up their projects, so most of the host organizations want the students to stay and work with them on full-time basis.
Right. So when it comes to Pakistan, of course, you said that this sector is, wide open, kafi scope, and like healthcare management is obviously quite an important thing in Pakistan, given that, we're not that on that level of development yet. Where do you see this industry moving forward in the next decade at least?
I see that we will be moving where the world has already moved on. So the idea is that medical specialists, clinical doctors, they concentrate on their role, while the administration part is left to experts in that area. So looking at few years down the road, inshallah, we're looking at our graduates to occupy these positions in terms of CEOs and CEOs of the hospitals. So assuming leadership position on the management side.
Right. Very interesting. So of course, most of our listeners would be interested in this program. So do you have any message for them in terms of, application, what they're looking for?
From both perspectives, one in terms of the space to consume, बहुत ज़रूरत है इस वक्त people who can go and implement. And secondly, this is one sector which is rewarding on both sides. Monetary reward bhi, or plus when you see people helping, this is something where you can see the improvement. So हमारे patients hospitals में जाते हैं 4-4, 8-8 घंटे बैठे होते हैं, and then the quality of service. So if you make an intervention, you can see the reward just there in terms of patient satisfaction, healthy patients walking out of the system.
Indeed. Right. Aakhri sawal before we conclude, sir. What are some scholarship opportunities offered for your program?
So again, I'll answer this from two aspects. One is in terms of scholarship opportunities, but then on the broader level, opportunities for all applicants. So it offers 50% scholarship to all admitted female candidates. So that's one thing. The other is the program is designed in a way, as I said earlier, that it's a weekend program, and weekend maybe it's a blended learning program. So we have classes on alternate weekends, or usme bhi one is on campus and the other is online. So they're required to come to campus just once a month or one weekend every month. So this also opens up opportunities for a lot of females from this sector who have left the sector because of their domestic commitments to take up these opportunities. So it offers work-life balance as well in terms during the program, and plus then they can take up these administrative roles which are not that hectic, requiring round-the-clock services. So that's and we have seen that we've seen a lot of interest from this audience in last two cohorts, and we're looking forward to welcome people with such background as well.
Thank you so much, Dr. Hassan, for being a part of our show. This was Radio LUMS. You can check out our other interviews about MS programs around LUMS on our YouTube channel as well. Please also check out the LUMS website for more information on this program. Before concluding, it is pertinent to mention that graduate programs at LUMS offer a 50% scholarship to all staff members. This was Ibrahim Arif. Thank you so much for listening to Radio LUMS. Goodbye and Allah Hafiz.
Allah Hafiz.